Dr. Nucci from Nucci Medical. Thank you for joining us for our coffee talk. I have coffee. They only filled it up halfway. They say I don't drink it all, so maybe I need to drink more or talk slower or something. Anyway, there's Austin, Texas behind us, I hear. It's a little bit different than last time I was there, but that's what I understand. So Austin, Texas. So today's talk is on golf injuries and the spine, or spine injuries in golf. It's a big topic, actually, because truth is any part of the spine can be injured when doing sports and golf in particular. With golf, and I played some, I'm not a super golfer, but played some golf. With golf, we're talking about the golf swing mostly. And I think one of the things that golfers know is that it's not really a swing. It's more of a body twist. It's a whole body motion. And that's important because you're moving the entire spine. You're moving really the upper and lower body. It's a complete movement. And that movement, I think most golfers know this too, should be a smooth movement, right? Should be smooth. Some say, effortless almost. Kind of thing is often a good swing, but a smooth motion and jerky type motions or stopping and so on, aren't very good golf swings. And that's important from the standpoint of the spine because spine should be fluid motion. You should have fluid motion. When you walk, it's a fluid motion, assuming you have no other injuries. A normal walking, it's a fluid motion, right? If you trip and you twist and you can hurt your back or hurt something because it's not natural, and your body is trying to compensate for that unnatural fall or unnatural trip, that kind of thing. So with golf, certainly, if you have a choppy swing or something, you're going to be pushing things in a way that may injure yourself. But from the standpoint of golf injuries in general, we should talk a bit about the different components of the spine and the motion involved. When you're walking or when you're swinging or when you're twisting, there's several things that are moving in the spine. The neck and back are different animals, but for purposes of the discussion, we'll consider them the same thing at this point. You have the muscles, of course. The muscles are moving when you move and when you swing. So one of the things certainly you can do, and one of the more common injuries in golf, is a muscular type injury. You twist and you pull a muscle or part of a muscle in the swing, or you are sore in the muscle. So that muscle aspect is certainly one big part of golf injuries, and they're not usually serious, and those go away. The next part of the spine to really talk about, sort of going from outside to inside per se, and maybe middle to side. The next thing we'll talk about are the joints of the spine, and those move when you move. And I actually have my nice model here again. This is a big spine model, and here's the back of the spine, the spinous process, and there's the disc in there, and your vertebral bodies, and there's your spinal nerves in there. In any case, your joints, I don't know if you can see it as I move it, but these joints would move, right? These are the facet joints. They move up and down, and they're actually oriented in slightly different ways as you go from maybe the upper mid back, or say upper low back, I should say, down to the very low back. The joints sort of twist, and actually at the lower level are more like this, and then they sort of go like this. So point being that they allow the twisting motion. So here you can see the joints side by side. You can appreciate that at all, and that would be the side by side motion. But if they're like this, there would be a different kind of bending motion. So the motion, point of it being the motion of the spine, these joints move and these joints twist. And they certainly can be injured at one or more levels. Sometimes people say, I twisted, I felt a pop. That's many times a facet joint or a joint of the spine. It can also be a muscle, but often the joint of the spine. And those are injured easily. So that's one of the things to think about if you have a back pain or injury from the spine. We're not going to talk about treatment per se today. We're talking about the injuries. Fortunately, that also usually gets better. And again, more of the fluid motion rather than jerky motion, less likely to injure those joints because then they'd be moving in a smooth fashion. Another injury in this with golf, unfortunately not super common, but common enough, is a disc injury. Again, going from the outside in. So now we're talking about the disc, right? Here is the disc of the spine. I guess it's larger. This is a larger model than the actual spine itself. But there's your disc, right? It's a soft structure. And the disc is, I've described it many ways, but one way to describe it is like a radial tire, like a car tire, radial tire. And if you know anything about tires, I don't know that much about tires, but what I do know is they have different fibers per se running in different directions. Radial tire, it's got different layers of fibers running in different directions to allow for it to move on the road and as you turn. Similarly, in the spine, it's not just sort of a round thing in there. It's very much like that radial tire. You have fibers going this way, fibers going this way, fibers going this way. And that allows for it to be able to twist and take twisting, the stress of twisting motion. So in a golf swing, because we're talking about the swing again mostly here, is a twisting motion. Right? There's a rotational motion, and you're rotating the spine. We talked about the joints in back sort of moving, and you're also twisting the disc. The disc is twisting. Now, it's designed to twist. I mean, that's per se, it's designed to twist. But you can twist it, wring it out in a way that ruptures the disc. So another golf type injury from a twisting, rotating type motion would be a disc herniation. I'll get to use my cool model again if you can appreciate this or not. But as we twist, there you go. See that little thing popping out there? That is a model of a disc herniation. So the inside of the disc, which is usually a softer structure, can pop out, and that can cause pain and nerve injury or nerve irritation and sciatic pain and so on. So that's another spine injury when you're golfing. So again, the fluid motion is better than the not fluid motion. I always mention the story of a professional football player who's a patient of mine years ago, and he's out there, and there's a lineman out there, taking major hits, right? And he was out playing golf and threw his golf clubs in his car, and give it a twist, which he's not normally usually twists that way, and he got a disc herniation as a result of that. So, motion that you may not be used to, or an abnormal motion that puts abnormal stresses on the disc, or at least stresses you're not normally used to compensating for, may cause a disc injury. Similarly, in golf, you can have that kind of injury. So now going from the mid to the sides, right? Going from middle to sides, we deal with the sacroiliac joint. Sacroiliac joint, and I have a picture here. So this is, as I said, this is a big topic. Sacroiliac joints. Okay, here we go. Here's my fountain pen here. We have the spine, right? And those are the muscles we talked about earlier, right? And they're the joints, if you can see it or not here. But the sacroiliac joints are these large joints that connect the spine to the pelvis. So there's one on each side, and they do not move very much. As a matter of fact, years ago, maybe 30 years ago, 40 years ago, there was the idea that sacroiliac joints rarely cause of spine pain. Turns out it is a common cause of spine pain, and one of the ones that we become much more aware of. Now, the sacroiliac joints are fixed pretty much with ligaments. They don't really move very much, but they do move a little bit, and they move in the golf swing, assuming you don't have frozen joint for some abnormal pathological reason. Not that common. But in any case, the joints are fairly locked, but they do move. And with the swing, you move the joints. That's part of the motion. And you certainly can have a sacroiliac joint injury, sacroiliac joint pain. And runners see that too. They talk about foot pain all the time, but sacroiliac joint pain is also common in runners. Another coffee talk. But the point being that the leg attaches to the hip, and the hip attaches to the pelvis attaches to the spine. That connection of the two, sacroiliac joint rotation, can injure the sacroiliac joint. So one must think about sacroiliac joint, type pain. As far as other kinds of pain go, and I said I was going to talk about the neck and back as sort of one, but the neck is a bit more prone to those type of injuries that you get from twisting. You're twisting the upper neck. You can have neck pain in the upper neck because that's where the motion, occurs in that area. So upper neck pain from twisting also can occur, but generally you're talking about spine pain. Now, moving again out from midline and out, shoulders, right? Your shoulders. Again, that's upper body, but your shoulders are moving, and you can certainly have a shoulder injury in the muscle of the shoulder on the inside, or the deeper muscles underneath the larger deltoid muscle. as you're rotating, you can certainly impinge your shoulder. In other words, your arm bone pinches the area of the shoulder, and that can also give you pain. So shoulder injuries also or can be seen in golf injuries. You think of shoulder injuries, and I know this is a spine talk, but the reason I bring it up is that shoulder pain can mimic neck pain. So someone comes in, yeah, I really, and they turn out it's their shoulder. So you have to be aware. It's all connected. You have to be aware that when someone has come in complaining of maybe neck pain from when they're golfing or when they twist in golf, you have to be aware it can be also a shoulder injury. So that is a brief discussion of injuries in golf with the spine. But the truth is, the entire spine can be injured because the golf swing, and again, it's more rotation. The swing is not natural. It's not something you naturally have to sort of learn it. Some people are naturally good at it, but generally, it's a learned. And as you learn something, you may not be smooth as you would like to be, or maybe you're throwing your golf club or something. But not as smooth as you like, and then you can, of course, get that type of injury by moving in a way that your body is not accustomed to or not compensating for in some way, and then you end up injuring one of those structures, which we discussed. So there you have golf and the spine. Sounds like a good topic. So I don't know if we have any questions. I don't know how long I went. I think I sort of went on for a little longer than usual, but I don't know. I have a time thing here, so I can't say. Let's see. Oh, there's a question. And we didn't discuss this. And I was going to, but so there you go. Somebody asked it. How do you prevent a golf injury? Well, golf is learned, and learning it to your swing and so on correctly is important. And I think that's probably the best advice is to learn how to swing correctly, practice how to do it, and the more becomes a normal activity, something that you're accustomed to, your brain muscle connection is more flows better. That's a whole other discussion. The mind, it's not mind body, well, it's mind body, but it's brain physiology, muscle physiology. That connection, the more you establish that connection, the more you establish that motion as something you're used to, something that's normal, the less likely you are to have any type of injury, and a golf injury would be one of those. And then beyond that, it's general health kind of thing. So best way to prevent it is maybe play more golf. All right, that's the best way to prevent it. Just do more, but do it correctly. All right. We have another one. After surgery, what is the recovery time in order to get back on the golf course? Well, of course, it depends on the kind of surgery, definitely. I tend, and this is a trend that's started years ago, was to return to activities as quickly as possible. And one of the things we learned is that patients often will respond to increasing, returning to full activity fairly quickly. So depends on the surgery, right? If you have a major reconstructive surgery from a major car accident, it can take many months or years. But if we're talking about a muscle injury or a joint injury that we discussed earlier, even a disc injury, these things usually get better. Muscle, a couple of days, a couple of weeks. Joint injuries, the facet injuries we just talked about, usually a couple of weeks improve significantly. And then the disc injury often improves too without surgery in 6 8 weeks. The point being that as far as returning to golf, I would return slowly as you begin to improve, because what happens is if you, as we mentioned earlier, it's a mind-muscle connection, and the longer you're away from doing that activity, the less that connection remains. So if you return sooner, you're likely to return better than if you wait longer and have to sort of relearn that muscle connection. So there's no really firm answer, but for me, I like people to return as all things being equal, as quickly as they can to that activity, starting slow and then moving. But it's a big question, and you'd have to ask whoever's taking care of you for your specific injury. But returning sooner rather than later really is the answer. Can someone develop a herniation while golfing? Yeah, sure, absolutely. We discussed it a little bit earlier. That the discs of the back. I think they said about disc herniation. Yes, disc herniation. The discs of the back, as we mentioned before, are like a radial tire, and they allow twisting. They're designed to deal with stresses of twisting and bending. And golf is a twisting, bending type activity, and then the disc that's what it's made to do. But if the disc is weak for whatever reason, age or whatever, or it's twisted in a way that maybe you're not normally do it, certainly you can twist that disc and cause a disc herniation. It does happen, and it's one of the disc injuries. Excuse me, one of the injuries that you would see in golf is a disc injury. Mm-hmm. All right, and to the neck. Okay, to the neck. Okay. Let's see. Injury to the neck. Same thing. You can have injury to the neck. I'm getting a signal that I may be going over my time. I might have to go. Oh, I am over my time. I now have a clock. I am over the time by 1 minute. So I think I'm going to have to sign off. I don't want to overstay my welcome here. In any case, thank you for joining our coffee talk, and we will have another exciting coffee talk next week. And I think I answered all the questions, so I think I'm good. Sorry for 1 minute over. I have to sign off now. My sponsors will get. No, we don't have any sponsors. We're sponsoring. I'm sponsoring, so I'll have to get upset with myself. So see you next time.